And so I think historically, though, most of us get ultrasounds, right? So someone comes in with irregular bleeding, get an ultrasound. If it's totally normal, how often are we missing a focal lesion, a focal polyp, a fibroid, or retained products?
Let me just ask you, I saw a patient yesterday. She's 67, since 2016, has postmenopausal bleeding a little bit, 2 or 3 days, every other month since 2016 with an endometrial echo of 2 millimeters. Okay, multiple endometrial biopsies. What would you do? Now, I saw her first time yesterday. Have her, like you said, she has an ultrasound. Some of the biopsies, no tissue. Some of the biopsy, inactive endometrium. Some of the times they haven't been able to get in, but her symptoms have persisted. I mean, this is a typical kind of, so let me kind of, if you don't mind, what would you do? And then I can tell you what I'm going to do.
Yeah. So if somebody comes to see me,
Mm-hmm.
postmenopausal bleeding, 2 millimeter stripe, and they've had one episode,
Mm-hmm.
then we watch. If the bleeding continues,
2016.
well, right. So I'll tell you what I would do.
4 doctors she's seen. I'm just telling you. I wish I could pull up the chart and show you, but yeah. Mm-hmm.
I would say reassurance. Okay, she comes back. I said, if your bleeding continues, come back and see me. Okay.
Mm-hmm. Okay.
Now we're saying it's every other month.
Mm-hmm.
Comes back to see me. Ultrasound's normal. We'll just do a biopsy, make sure there's no cancer. Now, if we
Mm-hmm.
get normal, non-cancer, then I'm again reassured for a little while,
Mm-hmm.
and I feel confident based on what I understand about the data that it's not cancer.
Mm-hmm.
Now,
Mm-hmm.
if her symptoms continue, then I'm not done. Then we look.
Okay.
So I've got an ultrasound to see if there's any focal
Mm-hmm.
lesions. We do a biopsy to rule out cancer, and if the symptoms continue and persist,
Right.
then we have a pretty good reason to take a look, because ultrasounds can occasionally miss a little polyp, a little cervical polyp. You go in there and that's it. But I wouldn't personally start with that.
Well, I would. I start with that. So but it depends on how the patient comes to see me, because if you have a thin patient, a normal uterus, no adnexal masses, and again, you're asking about someone who's practiced. Someone asked me the most hysteroscopies I've ever done in one day in my office is 13. Okay. Somebody that's overweight, I can't feel, has a 20-week size uterus. Yes, I may get some other things, but I can see her right then, unless she's had a couple of things to go on. In her particular case, she had a cerclage, she had a set of twins, and she had another child, 2 C-sections for 3 children in her cerclage. So I'm going to soften her cervix, and I'm bringing her back for hysteroscopy, because what you're going to miss, to me, with ultrasound, those small polyps, the uterus is compressed. It's very elusive, and polyps can conform to the endometrium. To me, at our hospital, and I did pioneer the term, and I think it was 1994, 1997, the word SIS. I have a paper that's published in the Green Journal, where, to me, if you're going to believe in ultrasound for bleeding, it should be SIS, because you open the cavity. You can look for irregularities. You can look for asynchrony of the endometrium. But what you're going to sometimes miss are those small little polyp-like lesions near the endometrium. The tubulostia. Things that go on in the cervix. There are lesions in the cervix that can be missed. So for me, I think because we have like 9 scopes, can reuse them. It's easy. Our nurses have things, if they have a tiny stenotic cervix in the history that this patient have, I'm going to treat her with several things to make the success better for that. So again, I think medicine's an art as much as it is a science, but I think the sensitivity for hysteroscopy is much greater than ultrasound. And I tend to reserve ultrasound. When I've done this and find nothing, we know that 3 to 5% of endometrial bleeding can be due to ovarian lesions. And I'll do an ultrasound for that reason if everything has come out normal. We've picked up fallopian tube cancers that are bleeding. You see a hydrocele, something swollen. Endometrial cancer can present, ovarian cancer can present. It's rare, but we all in our collective years of service see that. So I think it also depends on what tool you have.